Uganda's commitment to the United Nations agenda is firmly embedded in our national development strategies. Our Vision 2030 aims to transform Uganda from a peasant economy into a modern, prosperous nation. The National Development Plan 3 is currently 90% aligned with the Sustainable Development Goals, and we are committed to ensuring that the upcoming National Development Plan 4 will achieve full alignment. The Uganda United Nations Sustainable Development Cooperation Framework 2021-2025, implemented by 29 UN agencies, serves as a crucial strategic blueprint that aligns with both our Vision 2040 and the National Development Plan 3. We anticipate that the forthcoming cooperation framework will also align seemingly with the National Development Plan 4. Uganda is dedicated to enhancing service delivery in several key areas. 1. Health. We have established robust systems supporting both preventive and curative services. Significant investments in health infrastructure and professional capacity building has led to notable notable improvement in the health outcomes. Uganda remains steadfast in its commitment to the United Nations agenda. Uganda also has our strategic priorities align with the global vision of a more inclusive, equitable, and sustainable world. We look forward to strengthening partnerships with our European and Middle East counterparts to build a future where healthcare, education, sustainable agriculture, and green energy are accessible to all. I thank you so much for God and my country.
What? This means if you want something, you can have it. It doesn't mean you have to have the money to have it. The will, the vision. And I say that New York has meant a lot to me, and I've been back and forth since 1993 to Washington, D.C. to New York. This is why I came forward to say why we cannot do something together to put people together, to put the rich, the middle class, the poor, and this is how we can get better life for everyone. So ECAM Council is about how we can bring a visionary people, a business leaders, a government together to solve somehow and many difficulty and problem in this world. And I think is if you don't live and feel it, and you know from where you come from, then you cannot make it happen.
But maybe I would like to focus on what we're doing in terms of strengthening the continental capacity. When I say this continental capacity, it's the Africa CDC. When I say continental capacity, it's the Africa Medicines Agency. And that's what we're doing now. So local capacity at country level, that's where we're focused. But at the same time, continental capacity like the Africa CDC and Africa Medicines Agency. With Africa CDC, we have been supporting to strengthen it. And there is a historic development recently. As you know, Africa CDC has declared emergency of Mpox in Africa, and I have declared the emergency of Mpox globally, almost a day after each other. So the African Continental Emergency was just a day before the global. So we're fully aligned. But not only that, for the first time, Africa CDC has become a major partner, and WHO and Africa CDC have together prepared the continental response strategy, and we're also co-leading the response. And I'm the proudest person to say this because I proposed the idea of Africa CDC when I was foreign minister in 2013, July, in Abuja, during an AU summit. So I'm really glad to see Africa CDC grow from strength to strength. We will continue to give both financial and technical support.